What they don't teach you in nursing school, but what you absolutely need to know to pass the NCLEX is how to think like the exam. Nursing school focuses almost entirely on content, pathophysiology, medications, procedures, lab values, and disease processes. Students spend years memorizing information, yet very little time is spent teaching how to answer NCLEX-style questions, how to recognize tricky wording, how to prioritize safely, or how to apply clinical judgment the way the exam expects. Unless students independently seek out additional NCLEX preparation, most graduate without ever being taught how to separate clinical knowledge from test-taking strategy. This gap is not because nursing educators don't care, but because nursing programs are constrained by time, accreditation standards, and the overwhelming amount of material that must be covered to prepare safe, competent nurses. The NCLEX is not a content-based exam. It is a clinical judgment exam. The exam assumes you already know the information and is testing how you apply it under pressure. Many students fail not because they lack knowledge, but because they do not understand how the exam is written or what it is truly asking. This is why students often report that the NCLEX felt confusing, that 2 answers seemed correct, or that they studied extensively, yet the questions looked unfamiliar. These experiences are rarely due to poor preparation in content and far more often due to a lack of explicit training in test-taking strategy, prioritization frameworks, and decision-making patterns. Nursing school often does not have the time to teach these strategies in depth, and many NCLEX review courses face the same limitation. Review programs must rapidly recover large volumes of content, accommodate students with varying knowledge gaps, and prepare learners for every possible topic that could appear on the exam. As a result, test-taking strategies are frequently taught briefly, assumed rather than explained or overshadowed by content review. However, strategy is not something students simply absorb. It must be intentionally taught, practiced, and reinforced. Without it, even strong students can struggle. The truth is that passing the NCLEX requires both content mastery and strategic thinking. Content tells you what is happening clinically, but strategy tells you what action is safest, most appropriate, and most consistent with entry-level nursing practice. Students often choose incorrect answers because they overthink, focus on details rather than priorities, overlook keywords such as first, best, or most important, or answer as a student instead of as a safe, newly licensed nurse. The NCLEX does not reward perfection or advanced knowledge. It rewards safety, prioritization, and sound clinical judgment. This section exists to teach the thinking patterns nursing students are rarely shown but desperately need. These include recognizing what the question is truly asking, identifying distractors designed to confuse, applying safety and prioritization frameworks, distinguishing assessment from intervention, and answering effectively even when the diagnosis or medication is unfamiliar. These skills are especially critical for repeat test takers, international students, and those who have been away from school for a long time, as they often have the knowledge but lack confidence in how to apply it on high-stakes exams. Passing the NCLEX is not about knowing more information. It is about thinking differently. When students understand how the NCLEX is structured and how clinical judgment is evaluated, the exam stops feeling unpredictable and intimidating. Instead of being controlled by the test, students gain the ability to approach each question with clarity, confidence, and purpose, skills that not only improve NCLEX outcomes, but also strengthen real-world nursing practice.